Not only has the toxic drug crisis affected people who have lost loved ones, but also the frontline workers themselves who are helping people with treatment and recovery. So tonight we're talking to Keir Macdonald, CEO of Surrey's Phoenix Society, which helps people leave the cycle of addiction and homelessness. Thanks for joining us tonight, Keir.
Good evening.
Now, we are 5 years into this public health emergency. Being on the front lines, what changes have you seen in that time period in terms of who's coming in and how they are using?
Look, it's been an incredible 5 years. I mean, when we've seen sort of that from those first, weeks and days back in, 2016, where we really did feel that urgency, the public health emergency being announced in April, but really those services were being ramped up really quickly. We saw things like overdose prevention services, supervised consumption services, the rollout of naloxone. There definitely seemed to be a lot of urgency and activity, but also a lot of us adjusting and reacting to what was this new crisis, what was fentanyl. We were hearing all of these things, but really didn't quite understand it. Over the preceding next 2-3 years, we really continued to do much of what we had done. But, the numbers continued to stabilise. They were rising and then they dropped just pre-COVID. And then, as we all know, things came back in a vengeance last year with a record taking over 1,700 people lost.
Okay, so it's clear the COVID-19 pandemic has really pushed things to the edge.
It has, and we saw again this tremendous spike in losses last year. People were struggling in those early days to access those vital supports, those overdose prevention sites. People were isolating. And so whether you were using substances or you formerly used substances, people's isolation really led to damaging mental health. Over 80% of people are dying alone in their homes. And so COVID really had a dramatic impact on people's ability to do the things that they did to keep them safe.
Well, and I can only imagine seeing all of this unfold, being on the front lines of the crisis now, especially during the pandemic, must be mentally taxing for you. What has it been like these last 5 years and more recently?
It was definitely draining in the early years as well, because just so unpredictably, we just kept losing people. I think what has gone from being a bit draining and burnout and sadness is coming up for anger in people. We are 5 years into this crisis now. I think what's most frustrating these days is there is a lot of talk, even some great announcements, but the delays from the announcements to when we're actually seeing these services implemented or these policies implemented is just taking too long. People are so frustrated and starting to get angry.
So what's the solution here? How do you close that gap between solutions and actually implementing them?
It's a great question. Again, I think the government's doing what they can in terms of heading in the right direction on some of the initiatives, but the rollout of some of these services is incredibly slow. What we were able to achieve in the early days of this crisis back in, 2016, and the rollout of overdose prevention services, from that first day when Minister Lake, announced the ability to roll out overdose prevention sites, we saw something like 5 services come online in roughly a week. But to even get a single site up and running in a community right now, it seems to take weeks and months and discussions. I just think that it takes, really cooperation across communities, across the health authorities and service providers to really see and treat this like the emergency that it is, and to act now.
Chief Executive Officer of the Phoenix Society, Keir Macdonald, thank you for your time tonight, and thank you for all that you're doing.
Thanks for having me.